There's so much disruption happening right now. Just thinking about the Affordable Care Act, our cost centers are now our profit centers, and our profit centers are now our cost centers. With wearable technologies, IoT, digitization, essentially all of our health services, a lot of core components of them are going to be digitized, and that's going to radically change the way that we provide care.
Disruption is a term that the healthcare industry really needs to get comfortable with. I think it's easy for those of us in that industry to look at Apple or Google or some of these things and we think that's interesting, but that's not healthcare. And we're so used to how we deliver care based in the hospital, based in the ambulatory clinic. But the same drivers that cause those industries to be radically changed are coming towards us. And that's why it's so critical for folks in our industry to be familiar with what leads to disruption, what's disruption versus a bright, shiny object. How can I either react to disruption, embrace disruption, or learn to disrupt myself? One of the reasons why disruption is important to us in healthcare is in the past we were used to conventional competitors. So your hospital A and hospital B gets a new MRI. So you've got to retaliate, so to speak, and bring your services up to that level. Or they get a new surgeon, you get a new surgeon. We were all really comfortable with that kind of competition, but you could almost think of it as a fort. You know, if those are the pillars of the fort, around the side, here come these disruptors. Amazon's in our space, Fitbit's in our space, Google's in our space. We're not prepared for that. We don't have the core competencies that they have. We have loyalties to certain ways of delivering services that they're completely naive to. And as a result, it doesn't hold them back about thinking differently about the future. So if we don't understand disruption and how current disruptors are working, we won't be either willing to do it ourselves or be able to spot those on the horizon.
I can just speak to the VA. I did work in the outside world for 25 years and am so thrilled to be a part of the VA because they really are on the forefront of many different kinds of innovations. We have the PAC team, which means it's like the medical home team. So there's a lot of things that can happen through that process. In terms of disrupting with the VA, I think that the Innovators Network is one way that we're able to do that.
Some of the big names that are potentially coming into the space, they do consumerism and consumer-driven products better than anybody. Healthcare is typically not known for that, so I see that. Along with maybe regulation, could also be a huge disruptor in the years to come.
So when I talk about what I see the future of health and healthcare, I talk about 6 things. So in the future, it will be proactive, if not predictive, instead of reactive and sick care. It'll be hyper personalized, individualized, tailored, configurable, instead of today, which is one size fits all, which is one size fits nobody. It'll be continuous and integrated instead of siloed and episodic and unintegrated and fragmented. It'll be decentralized, so it'll be out of institutions and out of buildings and into everywhere. Instead of today, which is extremely centralized, largely at clinics. It'll move from being paternalistic and kind of physician-driven to people-powered healthcare, is what I call it. So at least patients will be a partner in their decision-making instead of a kind of a passive recipient of instructions. And then finally, the whole paradigm will shift from being about costs and inputs to value and outcomes. So that's 6 big changes all happening at the same time.